Getting back with you, dear viewers, it was a marvelous report, and we really had enjoyed the visit of the Crown Prince, His Royal Highness Sheikh Mohammed bin Salman Al Saud to Kuwait, and each and every Kuwaiti is and has a brother from Saudi Arabia or the GCCs. And now, getting to more segments and our first guest here in the sunshine. Our guest for today is a dentist by profession who got in the field of hospital management and healthcare quality, have a postgraduate diploma in hospital management and specialized certifications in the field of healthcare quality like CPHQ, CPHHA and CHCQM. She have recently achieved board certification and Diplomate from the American Board of Healthcare Quality, a prestigious organization in the field, Farid.
Absolutely. Today she will be talking generally about the importance of quality and patient safety in hospitals, especially Taiba Hospital, importance of quality accreditation of hospitals. How does accreditation help the hospitals and patients? Let's all welcome Dr. Aysha John, Chief Quality Officer in Taiba Hospital. Good morning, Dr. Aysha.
Good morning. It's a great pleasure to be invited to this prestigious platform, and it's a great pleasure to talk to you and to your audience.
Thank you, thank you.
It is marvelous. Yeah, the pleasure is all ours. We know that there is a lot to be said about healthcare systems, and nowadays each and every one of us, Dr. Aysha, is really eager to go to a hospital where he can be really treated well, diagnosed well as he can have a little bit of a relaxation in the atmosphere. But before we go into that, I know my colleague Farid has a special question he always likes to ask, and that is his way. So go for it, Farid.
Actually, it's not a question. It's more than, like, you know, a lot of people, they have this myth. I don't know it's a myth or it's true, but you know, they say whenever the private sector hospitals get, you know, in trouble with the patient or some surgeons, you know, they drop it on the government hospital. So I know this is like a big issue, but you know, definitely you will address that, you know, while you talk to us about yourself.
Sure. Okay, well, myself, my name, Dr. Aysha John. You have already introduced myself, but just repeating myself. I have been in Taiba Hospital for the last 15 years. And,
15 years?
Yes, 15 years.
That's a lot.
Taiba Hospital has been a pioneer in many quality and patient safety initiatives, you know. So the question you asked me regarding
I remember Taiba Clinic used to be, right?
Yes.
And now it's hospital.
Hospital since 15 years actually. It's a rapid growth.
Easy,
yeah, exactly. Because we have leaders who have a very visionary thoughts, you know. So
it started a clinic and then it's a hospital. So this is really, that shows the leadership.
Of course. And when we talk about quality and patient safety, you know, though we term it as in one sentence, it has two different meanings. Yeah, quality generally means, you know, doing the right thing at the right time for the right person and producing the best outcome. Whereas patient safety talks about reducing the harm, injury or risks to patients. Yeah, but generally we use the term together, you know, quality and patient safety.
Patient safety. Now that's really amazing, you know, to have such quality and patient safety in that you know, manner. But what is healthcare quality? Definitely, and during, you know, the pandemic, for example, let's say was there that quality or patient safety you're talking about? Tell us about that.
Yeah. So before I go and give an example of healthcare quality, I think every one of us would want to know what is quality in general life. You know, in our daily life, how do you say quality? Okay, let me take a situation where one of you go buy a car tomorrow. Okay, so what are the dimensions of goodness you look into it? You would look into safety.
Yes.
You would look into the durability of the car.
Indeed.
Price comes a little later. Durability. You would look into the comfort, efficiency of the car, fuel efficiency, for example.
Yes. Indeed.
Comfort of the car, etc. So these are the dimensions of goodness. You look into everything. So the same thing applies to healthcare as well. So in healthcare, we have 6 dimensions of quality.
6?
Yes.
Okay.
So the 6 dimensions, they are. The first one, the most important one, safety.
Safety.
We all know what safety means.
To keep the patient alive.
Exactly. We do not want to add burden to their illness.
Exactly.
They come with a disease,
Exactly.
we don't want to add burden to it.
Exactly.
So that is the first, most integral dimension of quality. The second thing comes about effectiveness. Now, effectiveness generally, in normal terms, it means how useful something is. So, if medicine says this particular medication is good for a disease, we give the drug.
Absolutely.
And if the medicine says this medication is not good, we do not give them. So effectiveness actually matches science with care. It tells to use appropriately things which is of adding value to the care system and avoid using things which do not add value. So that's the most important dimension, again important dimension of quality, how effective is your care.
Okay.
The third dimension, which is a hot topic in every healthcare, is patient-centeredness.
Centeredness.
Yes, patient-centeredness. It generally, yes, it's a very interesting topic. It means how much of empowerment you give to your patients to decide on their healthcare.
Okay.
You know, you have heard about patient consents, you have heard about different kinds of educations to patients.
Yes.
Patients should be well aware about what their condition is.
Indeed.
Indeed. And they should take decisions.
When we go to a doctor, we need to know what's going on with us, how are you going to treat it, and all of that.
And so if he has something, if he has, let's say this, God forbid, cancer or whatever, you have to tell him.
You have to tell him, you have to tell him what is the prognosis of his condition, you know. And before going for a surgery, you need to explain the consent, you know, you need to be explained on the side effects of this surgery. So patients should be having the complete empowerment to decide what is good for them. I'm sure many of you have heard, there's nothing about me without me.
Yes.
I mean, I have to be part of my care system, you know. So that's an important dimension of quality.
So it is called patient-centeredness.
Patient-centeredness. You know, you keep the patient in center of the care system.
Centeredness?
Centeredness.
Okay.
Yeah.
That's nice.
Yeah.
Okay. And number 4?
Number 4, which all of you are very aware about, is timeliness.
Timeliness. Yes.
I think everyone, it's the most perceptive quality dimension where every one of us have waited outside hospitals, waiting to see doctors, waiting to conduct a test.
Wait. Produce anxiety and makes you really super worried, you know.
Exactly, and that's the, you know, that's the very tricky part of this dimension is some of the delays in healthcare are required, you know, it's instrumental. You can't avoid it. So you need to wait. But there are a lot of non-instrumental delays, you know, which can be really avoided and can be prevented in healthcare. So this is one important quality dimension, you know, timeliness.
Indeed. And 5?
5, we have efficiency.
Efficiency.
Basically, avoid wasting of resources. You know, you go do a test, don't make repeated test, you know, needless test procedures, you know. So these kind of efficiency is also very important in matter of quality. And the last is equity. Equity means everybody is, you know, treated equally. Treated equally. All of them should have access to care. All of them should have given respect during the care process. So that's equity. So these 6 dimensions of quality is very important for any organization to take it up as their mission, so that they improve on themselves, you know. So that is what in a round, in a small.
This is really great. 6 quality each and every hospital, I think, professionals, they need it. So.
But Amal, where the staff comes into that?
Those 6.
Those 6.
You mean where the staff, they are involved?
The staff, the doctors, the physicians, you know.
Exactly.
The high quality physicians, you know, super professional, you know, doctors who can really diagnose correctly. You see, let's you know, be more open,
yes,
Dr. Aysha, you know, and be more frank, you know. And frankly saying, we have, you know, a lot of buildings, a lot of devices, a lot of systems, but unfortunately, you know, a lot of people or patients, they go outside here. I had a wrong physician. I had a wrong diagnosis. Exactly, diagnosis. And you see, here's the dilemma, you know, although there are good doctors in Kuwait, but yet still we are facing such situations. How would you, explain that?
Where does quality come
Yeah.
into it? Well, one of the major quality standard in our hospital or in any accredited hospitals is something called as credentialing process and primary source verification.
Okay.
I'm not sure how many of you have heard about it. It's basically if you have any physicians coming and joining in, they do not touch a patient unless their entire certificates, unless their entire educational resources are being verified with the primary source.
Okay.
So once that is done, you wouldn't have any doctors with low competency. And for doctors, basically, competency and privileges is an ongoing process,
Exactly.
Yeah.
And quality KPIs is one important factor.
They gain it by the time.
Exactly, exactly. So that's one of the thing I could mention to your
Nice.
query
Well,
on that.
yeah. Another thing, I know that hospitals nowadays are really wanting to have that accreditations. So why is it important to attend or attain those accreditations?
Okay. Now, every one of us, we work in different organizations, and each one of us come every day to produce our best ability. And we may have internal checks and internal audits in place just to make sure everything is working fine and the employees are producing at the best capacity.
Okay.
But after a point of time, what happens is the working atmosphere and the culture just aligns in a particular direction. So there is no new thoughts or ideas coming in.
Routines.
It just gets to the routine.
Yeah.
So what happens? Maybe you would have seen if you have a new person joining into your organization, suddenly they get new ideas and thoughts. Now, why does that happen? Of course, they would have worked in a different culture, different environment, different protocols, different procedures. So bringing in an external organizations and coming to accredit actually helps you
From
to
outside,
see helps you to see your inefficiencies and your gaps in the process, very clearly, which would have crept into our organization without us even knowing it. We are so routine, we don't see such kind of gaps.
Right. Yeah, because we are inside the
You are
box,
inside
not out of the box.
Exactly.
Yeah,
But
if somebody external, definitely.
Of course.
Like in universities, they use external examiners, to correct, exams.
Exactly.
So it reflects more, the true quality of that.
Yeah, and having an accredited concept to get accredited, this concept actually requires a great commitment and transparency from the top management, because nobody wants to show your inefficiencies and gaps. So when you have visionary leaders, and that's where Taiba Hospital actually stands apart, where we have 3 visionary leaders, Dr. Sanad Al-Fadala, Chairman of Ilaj Healthcare, Ms. Lama Al-Fadala, Chief Executive Officer of Taiba, and Chairman and CEO of Ilaj Healthcare Service, Mr. Rashid Al-Fadala. These 3 visionary leaders always had quality and patient safety initiatives in their mission and vision,
Okay.
And that's why back in 2010, we had invited the Joint Commission International from the America to come and audit our hospital. And I'm really proud to say that we were one of the few hospitals in Kuwait who got accredited, and that too in the first attempt. And after that, there was no turning back. And we are now in the 4th re-accredited status.
Wow, the 4th.
4th. And each accreditation stays for 3 years. So, yeah.
Yes. See, it's 4th.
It's what?
The 4th accreditation.
Wow.
So each 3 years, you bring someone to
Yes.
to
It's like
people come from outside.
It's like an ISO,
Exactly.
doing for other
Exactly.
companies.
Exactly.
Is it like ISO?
ISO actually accredits not hospitals, but
companies and
yes, and JCI, Joint Commission accredits hospitals.
GCI, yeah?
JCI, Joint Commission Accreditation.
Nice. So they come and they
they look into every processes.
They are like inspectors.
Exactly, exactly. Yeah.
They think out
you
of
gotta
the
be
box.
ready.
They can say, so this is the 4th time, and you got it.
Yes.
That must be great. And let's get back a little bit of a point. My colleague Farid just said that during those 2 years, a lot of the healthcare system faced big challenges.
Exactly.
Taiba Hospital, I know that have moved forward with that. And let me be frank, whenever I want to travel, whenever I come from travel, the first thing I go is to Taiba Hospital to do the PCR.
Wow.
So
Nice.
because it is so efficient, it gets in
Hope it's cheap.
No, it's not. no,
so you gotta
average.
look into the
but
prices.
It is the average, the one that the Ministry of Health, Sheikh Basil Al-Sabah, has really said it's the same. It hasn't changed, but you don't go in and drive in through your car while you are sitting.
Exactly.
They would get everything and by like 6 hours and it's done.
Yes.
So That is really
Yeah.
big.
Yeah.
How did you get there?
Well, actually, you know, I'm proud to say that even before the first patient was having corona in Kuwait, I mean the first patient, we had all our protocols and procedures in place.
Wow.
We are very proactive in that aspect. We have a strong infection control department in Taiba Hospital who's very proactive, and I can call the whole team as a tiger team, you know. They're just waiting to listen. I mean, they have all the references from CDC, WHO, and they make sure that all the protocols in Taiba Hospital matches with it.
Okay.
So we were very proactive in that state, and having a PCR drive-in through was a great achievement as well.
Yes.
A lot of works behind it, but yes, we have achieved that status, yes.
Actually, definitely, it's Taiba Hospital is one of the health organization well known in Kuwait, and definitely it's well known by its staff and managers and leadership. You know, this is like the end of our interview. Unfortunately, Dr. Aysha, we would like to really talk to you more. If you have any last message for the viewers addressing any issue, for example, prices. A lot of people complaining prices, you know. So if you want to say something, please quickly.
Yeah.
Can do it.
Okay, last 2 years, our last topic is about health. So wishing all my viewers a very balanced mental and physical well-being. And for all professionals who would really want to come up in their career life, be a self-motivator, try to gain a new knowledge, and let the drive come from within. And have small accomplishments, be happy with it.
Yes.
And I always believe that success is not the key to happiness, but happiness is the key to success.
That is great.
Yes,
this is really wonderful.
And
Thank
if you love what you're doing, success will always follow you.
That's right. That is such a good thing to say at last. If you love what you're doing, then that is the key to happiness, success as well. Thank you very much, Dr. Aysha John, Chief Quality Officer from Taiba Hospital. And yes, they have the best PCR. This is what I can say.
Thank you.
And now how about we have a quick break, then getting back with more segments.